Live from Studio 5, this is NBC5 News Today.
Just ahead on NBC5 this morning, Cellulite Solutions. We're finding out what really works just in time for swimsuit season. Many women are fighting the battle with cellulite. So this morning, board-certified plastic surgeon Dr. Greg Wiener is here with some solutions. Good morning to you, doctor.
Good morning, Ellie. How are you?
Thanks for coming in. First of all, what is cellulite? I always think of it as the gross stuff behind your backside.
Yeah, all that nasty dimpling is actually caused by the fatty layer just beneath the skin. The fat's contained in tiny little chambers. And when the fat bulges in those chambers, or when those chambers become weak, that's when you get that nasty dimpling.
Ah, the nasty dimpling. So there are some new techniques out right now that could possibly work. Let's start off with the first one called thermage.
Correct. Well, thermage has been around for a while, and it's been used for facial wrinkles and things like that. But they just came out with a new technology that is supposed to heat the fatty layer and help smooth out those dimples. Not FDA approved yet, but the results can be promising.
Can be promising. We're showing some creams here. We're going to talk about these coming up in just a little bit. But there's also something called VeloSmooth.
VeloSmooth actually is FDA approved. This is a laser that came out of Israel, and it uses a couple of different modalities plus massage. And it actually, to me, looks like the best overall modality. But the operative word with any of these treatments is temporary. We don't have any long-term data on these things, and we actually don't know what's going to happen if you stop the treatments, and 6 months later, where will you be? But the initial results look good.
And those treatments, though, can be pricey as opposed to creams,
of course, pricey,
that are less expensive.
Absolutely. These treatments can go anywhere from $1,500 to $2,000, and there's more risk involved with these laser treatments also.
Right. So let's go through the less expensive alternatives.
Right.
You know, you hear some creams work, some don't. You also hear they don't work at all.
Right. These three happen to get pretty good reviews, and they can all be had for $15 to $30. Some of them are available at Target.
I love that.
Yeah, exactly. But again, once again, we're not dealing with any major scientific evidence that they work. Does any of the medicine in these creams actually penetrate into the fat and do what it says it's supposed to do? There's no evidence that it does that.
I put some on my hand. I'm waiting for some tingling to happen. It's not happening just yet?
No major effect yet, huh?
Okay. Well, and we were talking during the commercial break, too, that liposuction actually doesn't help with cellulite removal.
Correct. You know, the cellulite is right beneath the surface. So when you liposuction the fat deeper than that and have things collapse a little bit more, the cellulite could get worse.
So diet and exercise?
Absolutely.
Bottom line?
Bottom
like
line.
With everything
like everything
in life?
Else. Exactly.
No magic pill for it, huh?
No magic pill. You can try these things, and you may get some short-term benefit, but beware.
Okay, we have a before and after picture that we want to show real quick, and you can explain to us if this is from one of the therapies.
Right,
yeah.
This is from VeloSmooth, the one that I tend to favor, and there's some interesting results here. I mean, things look better.
That's phenomenal.
Again, where's that patient going to be a year after they stop the treatments? Who knows? We haven't done those. Those results aren't out there yet.
And if you have the disposable income possibly to maintain those treatments.
Exactly.
But with high prices of gas these days, who knows who has that money?
That's
anyway,
for sure.
Thank you so much, Dr. Greg
Thanks
Wiener.
for having me.
For more information, log on to our website, NBC5.com. Just click on the As Seen On button for a link to Dr. Wiener's website.